Hi everyone, this is Prakash. I'm a sports physiotherapist. Today I'm going to talk about how a physiotherapist is different from a sports physiotherapist. A lot of people have asked me how a sports physiotherapist is different from a physiotherapist. So basically, they have a different education qualification. A normal physiotherapist undergoes a 4.5 year undergraduate program to get a title physiotherapist. After that, if they are pursuing a 2 year master degree program in sports, then they become sports physiotherapist. Now, I'm going to talk about how I am helping out my clients with my sports physiotherapy background. So, people are visiting me, be it athletic background and a non-athletic background, with different sort of issues, and I'm helping them out with my skills. So if I basically divide my uh, advice and treatment options for different individuals, I'm going to divide them into five different categories. So people visit basically for injury management, joint pathology management, performance enhancement, exercise tuning, and when they are returning to sports, they also seek my advice. So, if we are going to talk about injury management, in injury management, basically we are helping them out with the management of pain. Sometimes we do with the help of hot pack, cold pack, and with different electronic gadgets as well. The second part of injury management comes to the biomechanical correction of the cause of the pain. Sometimes this biomechanical fault is lying because of something wrong in the muscle, something wrong with the posture, something wrong with the joint, or with poor movement. We treat this issue with the help of manual therapy and specific exercises under supervision. Now, the second part that I'm helping out is joint pathologies. I'm giving an example of a disc issue because this is a very common issue amongst the athletic population as well as non-athletic populations. By the age of 30, a lot of people have disc issues nowadays because of the sedentary lifestyle. It doesn't matter like whether you have a sedentary lifestyle or a athletic lifestyle, it can happen to you at any time. So, if an individual is having a disc issue and they undergo any sort of treatment with the physiotherapist, they manage their pain with the help of different electronic gadgets, some manual therapy, some exercises. Once their pain is sorted, as a sports physiotherapist, I help them out in regaining their sports or returning to their sports or returning to their routine physical exercises, gym, yoga, or routine sports or routine walks. Technique tuning or exercise modification. A lot of people like who are performing regular exercise, they find difficulty in performing certain exercises. So as a sports physiotherapist, sometimes we correct those techniques if they are keeping the structures in a safe manner, or sometimes we provide an alternate exercise. The reason for providing alternate exercise is we are bothered about the tissues. So if they are getting compromised in a particular exercise with the wrong technique, we don't encourage to do that exercise for some period of time. In that same time, we give the individual an alternate exercise which targets the same muscle, same joint, so that the individual is able to increase or maintain his strength along that particular movement, but he's keeping his or her joint as a safe and sound structure for a proper movement. The fourth part of my intervention is performance enhancement. A lot of people visit me for this purpose. In different sports, you see a lot of physiotherapists are traveling with the team nowadays, and their one key role along with the team is performance enhancement. So, a sports physiotherapist analyzes the body movement by asking the individual to do certain activities related to their sports, related to their exercises, to see how they are performing when they are asked to do a multi joint movement. With the help of this analysis, we are able to know whether the joint is in trouble, is it getting stiff, whether the muscle is lacking flexibility, it doesn't have the proper length to stretch up to a good extent, whether there is an imbalance between the right side or left side of the body, imbalance between the front and back side of the body, or whether there is lack of coordination amongst both the side of the body. Now, the fifth part is return to any sport. So, when an individual is going any sort of treatment, medicines, surgery, naturopathy, physiotherapy, they need strict supervision in the beginning when they are returning to their sports. So, we make sure when they are performing any sporting activities, their body is moving in a precise manner so that they don't get that injury again. It goes like the same with any individual who is not from a sporty background but is doing regular exercise in any gym or performing yoga. So in this way you can say like a sports physiotherapist who is working in a particular gym, which is not a very healthy practice in India, but you see physiotherapists are helping the individuals out in the gym in European countries. So usually they help the individual in understanding what is the right weight that they should lift after a particular condition, whether weight training is good for them, right, or not, or whether they should wait for some more time, things like that. As I mentioned, like in European countries, a lot of sports physiotherapists are available at different gym. Now I'm going to talk about like how they are important if they are participating their role in different gym. Basically, if the people are visiting the gym, they have mild niggles or aches and pains, so sometimes they miss out the gym. Sometimes they feel like the pain or the problem is not that much, like they should not visit any physiotherapist or any doctor for that kind of issue. Sometimes they try to look for alternatives, like if this exercise is not helping me out, then I should try for something else. Sometimes they feel like my trainer is not well equipped with the science background or with the medical knowledge to help me out with this issue. Sometimes they feel, oh, I have this underlying issue and maybe the pain is coming back again. Maybe this exercise is not safe for me. So if there is a physiotherapist at the gym, so at least they can fill up the gap between the physiotherapist outside the gym to the trainer. So usually there is a communication gap between trainers and physiotherapists. So if there is an in-house physiotherapist, so he fills up the gap between the outside consultant, be it a doctor or be it anyone, to the trainer, like this is what is going wrong, and by keeping this thing in our mind, we can continue his training by not bothering any underlying issue. So these sort of things can be helped out with sports physiotherapists if they are available at any gym. So that's it. That's all from my side for today. Thank you. Usually they have a lot of questions in their mind when they are returning to sports, whether this exercise is helpful for me, whether this exercise is going to hurt me,